So hello everyone. Today in this video we are discuss about the cranial nerves examinations. So basically we have total 12 pairs of cranial nerves, right? So there are 12 pairs of cranial nerves in human. So first that is olfactory nerve, second optic nerve, third oculomotor, fourth trochlear, fifth trigeminal, 6. Abducent nerve. 7th. Facial. 8. Vestibulocochlear. 9. Glossopharyngeal. 10. Vagus nerve. 11. Accessory nerve. And 12. Hypoglossal nerve. Now, the which nerve is a sensory, which is motor, or some nerves that are mixed. So the question is, which is the sensory nerve, which is the motor nerves, and which are the mixed nerves? So here the answer is first, second, and eight, right? First, second, and eight, that are sensory nerve. Then 3, 4, 6, 11, and 12, that are pure motor nerve that supplies the muscles. And fifth, 7, 9, and 10, these four nerves are mixed type of nerve that is sensory as well as motor function also. So we can call it as a mixed or both kind of nerve. Now how to remember? So remember me that some says money matters, but my brother says big brain matters most, right? So this is one slogan. If you want to remember which now is sensory and which is motor, so you can remember these quotes easily, that some says money matters, but my brother says big brain matters most. So that means some. So that is S for sensory. So first cranial nerve is sensory, second is also sensory, then M, that is motor, so third, fourth is motor, B, that is both, so fifth nerve is mixed kind of nerve, that is both, sixth also motor, seventh mixed nerve, then 8S, that is sensory, 9 and 10 mixed nerve, 11 and 12 the motor nerves. Okay, so this is what the one code to remember which are the sensory or which are the motor nerves. Next, we are starting with the cranial nerve examination. So here in this video, we are just discuss about the first 11 and 12th cranial nerve. Later on, we will discuss next cranial nerve. So first is olfactory nerve. So it is pure sensory nerve. So what's the function of this nerve? So the function of olfactory nerve, that is to perceive a smell sensation, right? Now how to examine this nerve? So before evaluating smell, ensure that the nasal passages are open, right? If you want to check the olfactory nerve function, so you have to keep in mind the nasal passages which is clearly open. There is no any obstruction. So most cases of impaired smell are due to intranasal obstructions. Then smell is tasted using non-irritating stimuli, example coffee, lemon, oil, tobacco, mouthwash, toothpaste, alcohol, and soap. So these are the some material which you can use to check the taste sensation in the subject. And now how to examine? So examine each nostril separately while occluding the other with the patient's eye closed, right? So whenever you are trying to do examine, first of all you have to keep in mind the patient's or subject eye should be always closed, and you have to check the each nostril separately. Okay, not simultaneously both. Okay, so each nostril separately, and ask patient to sniff and indicate whether she smells something. And if patient is saying yes, I feel some smell, so ask subject to identify that product, right? So repeat for the other nostril and compare the two sides. Next, so abnormality. So olfactory abnormality, that is, it should be suspected with lesion of nasal cavity and anterior inferior cerebrum. If there is any suspected lesion is present in this area, so maybe this abnormality present. First is anosmia. So there is no sense of smell. So that condition known as anosmia. Hyposmia, that is a decrease in smell sense. Hyperosmia, that is an overly acute sense of smell. Dysosmia, impairment in the defect in sense of smell. Phantosmia, perception of an odor that actually not present. And last is presbyosmia, that is decrease in sense of smell due to aging. So these are some abnormalities lead to olfactory nerve damage. Now, next we will discuss about the 11th cranial nerve. So that it called as accessory nerve and which is pure motor nerve, and the function of 11th cranial nerve, that is movement of trapezius, and SCM, that is sternocleidomastoid muscle. Now how to check? So palpate trapezius, right? For trapezius, you have to ask subject shrug the shoulder against therapist resistance as much as you can, right? And evaluate the strength of the trapezius muscle. Now for the sternocleidomastoid muscle, ask the subject to turn head on one side like this, right? And push against therapist resistance, or you can say flex the head against resistance and evaluate strength of SCM muscle. Now you have to evaluate both right side as well and left side as well, and then compare for symmetry. Okay, so this is what about the 11th cranial nerve assessment. Next is 12th cranial nerve, that called as a hypoglossal nerve, which is also pure motor nerve. So the function of hypoglossal nerve is movement of tongue, hyoid bone. So this is our hyoid bone. Here the tongue and larynx during and after deglutition, right? So larynx and hyoid bone movement during and after deglutition. These are the functions of the 12th cranial nerve, that is hypoglossal, which is purely motor nerve. Now how to check, right? So it supply the extrinsic and intrinsic muscles of tongue. So for checking this, now you have to ask the subject to protrude the tongue and observe for weakness, reduction in size of affected side, excessive ridging and wrinkling, restricted protrusion, deviation towards one side, involuntary movements. Okay, so ask the subject to rotate the tongue side, inside, okay, inward, outward. So these are some movements which is produced by the tongue muscles, and if this type of any abnormality is seen in the movement, so we can say the hypoglossal nerve may be damaged. So this is what all about the hypoglossal nerve. Now common lesions in hypoglossal nerve. So the causes are maybe in syringomyelia, poliomyelitis, motor neuron disease, ALS, amyotrophic lateral sclerosis, and in hemiplegic patients, this nerve might be damaged. So thanks for watching my today video and subscribe my channel Physiomylife. We will discuss the next cranial nerve in the next part.